learnt one thing from the pandemic, it's how important primary care is to us. Primary care and general practices in particular have stepped up to do COVID testing. But general practices have also changed the way, and rapidly changed the way, they deliver care, shifting to telehealth. We've got a 10-year primary healthcare plan in development in this country, and here at CHF we want it to be just that, a plan for action. We also want to ensure that it's a plan that really considers how patients can be involved in setting their own healthcare goals. Now hear from three people who know a lot about patient activation, communication and effective communication between doctors and consumers, and self-management.
Effective communication really needs to be a two-way street between the clinician and the consumer. The consumer could be the patient, a family member, a carer, but at all times that person needs to be able to have the opportunity to understand and interact in an effective way. Health literacy is not essentially the driving force behind this. Enabling everybody to communicate effectively is the basis of appropriate engagement. There's so many opportunities for a consumer to be able to prepare and be ready for a consultation. So too, having a healthcare practitioner who is prepared to look at the individual and listen to what they're saying can be two key driving forces in successful engagement.
To effectively communicate with patients, it's important that clinicians learn what the patient's level of activation is, activation being their readiness to take on that partnership that most healthcare requires these days to do the things they need to do to take care of their health. And then once you know the patient's level of activation, you can tailor the consultation to bring the power of your relationship to focus in a way that will help them the most to continue to learn to work with you to take care of their health.
When working with patients with chronic disease, the evidence says that the patient's self-management of their condition is the most significant factor in helping them to improve their health. No amount of pills or treatment will significantly help a patient with chronic disease unless that patient is willing to better self-manage their condition. In order to know how to effectively manage or treat a person with a chronic condition, we need to know their level of patient activation. Because knowing a person's patient activation level allows the clinical team to better target their interventions.
Everything does not need to revolve around that driving force of time and money. So many opportunities present to enable us to prepare or be prepared for a consultation. So too, to focus on the clinical response to a consultation, enabling appropriate questions, listening skills, looking during the consultation are all key indicators of how effective communication can be achieved in a short period of time.
Like Professor Michael Greco and I have been teaching this around the world in the National Health Service in the UK, with clinicians in Australia, and also in the United States. We've found that there's a real win-win that occurs. Patients look forward to their visits, have high trust with their clinicians, and get better health results. And clinicians tell us that they're enjoying their practice more, feeling closer to their patients and getting a lot of what they went into medicine.
The patient activation measure is assessed by the patient completing a very brief 10-item questionnaire or a survey. And we know typically in a population such as Australia that about 40% of people will be lower activated and about 55 to 60% are more highly activated.
When we think about the future of primary health care, the discussion typically goes to how it will be funded. We need to think way beyond that to how patients can be better enabled to take control of their health and care. You've just heard a taster on this very question from Larry, Michael and Linda. All topics we'll be unpacking in a more detailed way in our next webinar. Tune in at 1 p.m. on the 23rd of September.